The push for assisted suicide here in the United States and around the world is gaining momentum. Here with analysis of these developments and more is neuroscientist and senior ethicist at the National Catholic Bioethics Center, Father Tad Pacholczyk. Father, thank you for being here. Delaware Governor Matt Meyer signed legislation to legalize physician-assisted suicide for some terminally ill patients. This is the 11th state to allow medical aid in dying after nearly a decade of debate on this issue. What do you make of this Delaware decision, Father?
Well, Raymond, I think we do see something of a trend here. 7 states currently have pending bills to legalize assisted suicide. And now the good news in all of this is that there are 11 states in the last year that have pushed back and, refused to ratify this kind of thing. But with all of that, then there's this kind of mixed piece, which is that there are 4 states that are trying to expand access by, in a sense, relaxing the current laws that allow for assisted suicide. So we have, kind of a mixed bag. I think Americans are a little bit ambiguous on this. I think people are uncomfortable with the notion of assisted suicide, but we see enough momentum from the advocates that it's gaining ground. I mean, as you know, in France as well, it was just legalized. And Great Britain is very active. The debate is very active over there as well. So, and, we have certain places like Oregon and the Netherlands where this is really well established and entrenched, and we can see, some of the fallout from those areas.
Yeah, well, on April 29th, the New York State Assembly passed a Medical Aid in Dying Act by a vote of 81 to 67. 20 Democrats broke ranks to join Republicans to oppose it, though it must still pass the Senate and receive Governor Kathy Hochul's signature. Your thoughts, whether this could get signed by her? Can it get through the Senate there and be signed by the governor? Is it likely to pass, do you think?
I think the fact that this is passed in California and New York a lot of times seem to be on the same wavelength. I'm not optimistic that they're going to be able to hold it back, but I know that, the church and others in the state are working vigorously to push back. I think, we're in a funny time, Raymond, just to kind of maybe broaden this a bit. I think that we have a lot of people who feel that when they get something like a terminal diagnosis, that, this is some kind of real option that they're imagining and supposing. And the reason is that they are living, in a certain sense, lives without real hope. And I think, the beauty of the Christian message is that we provide a real foundation of hope. And it reminds me of something that Pope Paul VI said many years ago. He said, our citizenship is in heaven, and we must live eschatologically. I know it's a big word, but it means, looking towards the next life, stretched toward the hope that does not disappoint. And we have so many people who are secular in their orientation without any kind of foundation in religion or faith. And with that, you don't have hope. I think you're always grasping at straws. And when things look desperate, physician-assisted suicide becomes a real temptation, and you almost start then to call it a good. And I think the fundamental error here is anytime we treat something that's objectively good, like our own life, the gift of life that we have not conferred upon ourselves, and we treat it as if it's an evil that needs to be expunged, that needs to be canceled out, we are crossing a huge and fundamental moral line. And, it's amazing how far this has gotten in my mind, but I do think it's a reflection of a very, very secularized society.
Yeah, well, I want to talk about Canada because that's very near to home here. Voluntary euthanasia accounted for 4.7% of the deaths in Canada in 2023. And new government data shows the country's 5th annual report since euthanasia was legalized in 2016, 15,300 people underwent assisted suicide last year. Father Tad, that's a shocking statistic. I mean, assisted suicide now accounts for 1 in 20 Canadian deaths. Isn't that a dress rehearsal for the rest of North America? And talk for a moment about the financial incentive here that we never hear discussed.
Yeah, the financial incentive is real. I'm reminded of a case a few years back in Oregon where there was a woman who had a cancer that was able to be treated using a particular drug that cost something like $2,000 per dose. It was a new drug. I think it was called Tarceva. And she wasn't able to get the Oregon health plan to pay for it, but they wrote her a letter declining to pay for it and at the same time noting that they would provide coverage for assistance in dying. And, she was furious about this, that this became, a financial consideration, which it truly is. And I think people feel the pressure. It's like, well, look, if I'm in a situation where I'm consuming a lot of resources. Don't I have an obligation to make an early exit? And the pressure is there. The pressure is real. And it doesn't come just from the side of the patient. It also comes, I'm afraid, from the side of the medical professionals. They will sometimes make their own assessments about what we call quality of life. And,
Yeah, I
that
love that.
ends up becoming a kind of a fait accompli where you then decline to provide what individuals really need and would benefit from, and kind of make hasty generalizations that cut their health care short. Now, this is also, worth mentioning in the same breath, Raymond, that what we have from the medical side of the equation is truly impressive, and I would even say outstanding when it's done right. And this would be palliative care. At the end of
Yeah.
life, providing the kind of attention that people need that's customized to their situation as they decline, but not offering them this temptation to take a toxin that the doctor has prescribed. I mean, I sometimes think about this just even in terms of the contradiction that's right at the heart of it with the medical
Yeah.
professional, helping out in this. I say to myself, look, would a doctor ever take a patient and let's say they're bound to a wheelchair because they're just so sick right now and getting close to death. Would he roll them out to a nearby bridge and then say to them, I'm not going to push you over the bridge, but now you can just step out and jump over the edge yourself? And we say, no, of course a doctor wouldn't do that, shouldn't do that. But that's precisely the same type of cooperation in evil that occurs when he writes the prescription for a deadly drug and then provides it for the patient to self-administer.
Well, and worse, Father, when they say, "Oh, but don't worry about it. You've got a two-doctor verification process." We've seen this in Europe, where two doctors have to sign off before this self-inflicted assisted dying can happen. Well, these two doctors, in many cases in Europe, we've seen they're pre-signing these documents. So again, there's a health pressure because of the financial, the money lost at end of life care. They want to hasten this. They want these people off the scene. French lawmakers, as you mentioned earlier, they approved a bill to legalize assisted dying. I mean, this is paving the way for France to become the latest European nation to allow the terminally ill to end their lives. Right now, Belgium, Luxembourg, Netherlands, Switzerland, Australia, Germany, Spain, Portugal, Austria rather, all allow so-called assisted dying in some form, Father Tad. Once Catholic France is now headed down this path. Why? Why do you think they're all embracing this?
Yeah, well, I mean, I do think it harkens back to this sense of a loss of hope that I alluded to earlier. And I mean, your point about the way the whole thing is shifting, that previously you required two doctors to verify. And there's a number of safeguards which are putatively put into place, waiting periods. You know what they're doing in Oregon? This is amazing. They're trying to get a bill passed that will reduce the waiting period after you request physician-assisted suicide to reduce it from 14 days to 2 days, just 2 days. That's a
Mm.
huge jump. And of course, this is precisely what happens, Raymond. As soon as it's been legalized, the reason you put the safeguards in at the beginning is for those people who are hesitant or doubtful about, doing physician-assisted suicide or voting for it. Well, maybe they'll get on board and support us. But then as soon as you've got the law in the books,
Uh-huh.
then you immediately weaken it, take away the
Start
safeguards.
contracting.
Another thing, yeah, exactly. And I mean, in the Netherlands, fascinating that they have had a requirement for reporting that the doctors, whenever they participate in this, they have to fill out a number of forms, explain the circumstances, and
Mm-hmm.
so on. And the doctors get tired of the forms. They've been, routine. This is euthanasia now, not physician-assisted suicide. So the doctor is actually killing the individuals. And what they do
Mm.
instead of going through the rigmarole of the paperwork, they just make a decision at a certain point to administer on their own initiative high doses of morphine and end the
Wow.
person's life, even if the person hasn't asked for it. And then they can just say, well, we're just managing pain. I don't have to fill out all the paperwork. So all these
Mm.
supposed safeguards, when you're crossing a fundamental moral line, it all just gets pushed to the side very quickly. And we end up, going down what's the proverbial slippery slope.
Yeah, well, and as you know, anytime you're dealing with people at end of life or with a catastrophic disease, depression is a real consideration. And when you give someone a 2-day window to reconsider their own death sentence, essentially, if they're in a depressive state, they may never come out of that.
Among depressed individuals already, in general, there is a 20-fold elevated rate of suicide. 20-fold. So now you offer them physician-assisted suicide as another option here. Of course, you're lowering the barriers and you're failing to provide the kind of mental health care that these individuals are entitled to. They're entitled to a
Yeah.
charitable concern on our part as Catholic healthcare providers and all healthcare providers. I mean, maybe let me just close, Raymond, with a reflection from Hippocrates, that ancient surgeon,
Mm.
Greek surgeon. I mean, he was secular, and he was very strongly opposed to this notion. I mean, he said, "I will never give a deadly potion to anybody who asks
Mm.
for it, nor will I make a suggestion to this effect." And I mean, that's exactly the attitude that I think all healthcare providers should be rigorously adopting. You don't have to be even religious to see it. He was, pre-Christian, 4th century BC, and already he could see with great clarity that key insight.
A bill to legalize assisted suicide in Illinois has stalled in the state Senate. If it passed, Father, it would have made it legal for doctors to give terminally ill patients life-ending drugs. Death certificates, etc., would list the cause of death as terminal illness, not suicide. A number of Catholic lawmakers argued against the bill, helping to stall it for now. Even Cardinal Blaise Cupich of Chicago condemned the bill, saying if passed, it would spur a suicide contagion. Your thoughts?
Well, it's very interesting because during the testimony for this bill, Raymond, there were practicing physicians who came out against it. One of them was actually Representative Bill Howder, a Republican. And he said, that if this passes, it will change forever the soul of medicine. And I think that's a wonderful
Mm.
way to put it. The physicians are pushing back. And, the American Medical Association has this code of ethics that has been part and parcel of their kind of background. And for years, it has basically said that any push for physician-assisted suicide is incompatible with the physician's role as healer. So my opinion here is that it is going to have to be the medical profession in particular that really
Yeah.
pushes back in alliance with the Catholic Church and with many Protestants who are also
Mm.
deeply concerned about this, and finally with disability groups as well.
Before we go, I want to get your reaction to this story. Adriana Smith, a pregnant woman in Georgia, was declared brain dead after a medical emergency. She's been kept on life support for 3 months by doctors to allow enough time for the baby to be born and comply with Georgia's strict anti-abortion law. Reports are she is being compelled to carry her baby to term due to the law. Father, talk about the ethical concerns at play here. It's a very sad situation. I mean, if the woman's taken off life support, chances are the baby, who's been named Chance, will not survive.
Yeah, absolutely. It's a tragic situation, as you point out. But through the miracles of medicine, we have this possibility, it appears in this particular case, to shuttle this pregnancy all the way to viability. Even though the mom is deceased, she had a series of blood clots and a stroke, and she's been diagnosed as brain dead. So there isn't anything they can do for the mom. And so the question becomes, isn't this reasonable to take care of the only remaining patient here, who is the baby Chance, as you said? And I think this is a very reasonable thing to attempt, and I'm glad that the hospital is doing this. I point out to people that a mom will take, extreme steps to protect her child. If her child, for example, if she was holding her child in her arms and she noticed maybe a man not too far away point a gun, and she was afraid that it would hit her baby, she would turn her back into the path of the bullet to take the bullet. So isn't it a reasonable thing to conclude that the mother here would be willing to give her body in this way over to the protection of her child?
Abortion advocates claim that continuing a pregnancy like this is akin to abusing a corpse, or, quote, making women human incubators, and that Adriana should be removed from life support so her family can bury her and grieve her passing. The hospital has declined to do that because of the pro-life bill in place in Georgia. My question is the continued use of life support, is that a case of extraordinary means? Could it be ethically
It really
stopped?
is. Yeah, no, it really is not a case of this because the mom is already deceased. You use the classical benefit burden analysis, which is ordinary, extraordinary, when you have a living person and you're making decisions about their well-being. That doesn't apply to the mom anymore. She has died. So you have to now shift over to the baby and ask, what about ordinary, extraordinary? Is it extraordinary for the baby to continue to gestate? Well, hardly, not really at all. I mean, this is the normal state of affairs for the baby in the womb. And so we need to do our best to support the continuation of that pregnancy in the hopes that baby Chance will be born. And, I think part of the reason, to be frank with you, that the other side is pushing so hard on this case, just think about it, Raymond. What if this baby were to be successfully born, crosses the threshold of viability and grows up and then later says, look at how generous my mom was. Even after she died, she offered, to take care of me in this way through this very unusual set of medical circumstances that I had to navigate as an unborn baby. So it's a real pro-life testament as well. So it's not an abuse of the corpse in any way. It's not that the mom's being used as an incubator. Think about it. If you were to go up to a pregnant woman walking down the street and say to her, hey, you're an incubator, I mean, she would be offended, and rightly so. And of course, the mom in this case, Adriana Smith, we can't use that kind of devaluing and dehumanizing language to describe her situation. It's tragic. It's true. We wish she was still alive, but it's not not reasonable to forego treatment on behalf of her child, who she clearly wanted to see the light of day.
Well, Father Tad Pacholczyk, thank you for your insight as always and for commentary by Father Tad. You can go to the National Catholic Bioethics Center website at ncbcenter.org. Thank you, Father.
Thank you so much, Raymond. Great to be with you.